A limb asymmetry of 10% or more has been reported to increase the risk of sport-related injury, and it is associated with lower performance. Increased limb asymmetries have been reported in collegiate athletes, but that is unclear of the same magnitude of asymmetry observed in non-athletes. The purpose of this study is to evaluate the symmetry between the dominant leg and the non-dominant leg of healthy, physically active college students. My hypothesis is that the healthy, physically active college students will not have a significant difference between the dominant limb and the non-dominant limb. They will have a higher symmetrical index compared to the collegiate athletes. A randomized crossover study was conducted at the University Biomechanics Laboratory, where 20 healthy, physically active, college-aged individuals participated in this study. These college students ranged from 18 to 24 years old, with 22.65 years old being the mean age. They were considered physically active because they exercised for 2.5 to 5 hours a week. These participants had not had a lower extremity injury in the past 6 months, an open wound on the thigh, or a lower extremity surgery in the past year. The participants attended 3 separate visits where they would begin by warming up on the bike for 5 minutes with no resistance before performing each test with the dominant limb and non-dominant limb. The rectus femoris flexibility was measured via digital inclinometer while the participant was in the Thomas test position. Single leg counter movement jump height was measured via the vertex scale. Isokinetic quadricep muscle strength was measured via the isokinetic dynamometer and was normalized to the individual's body weight. We measured peak concentric and eccentric knee extension torque. In the chart, you can see the measurements for the dominant leg and the non-dominant leg to compare them. There were no significant differences between the limbs of the participants for rectus femoris flexibility, single leg counter movement jump height, concentric knee extension torque, or eccentric knee extension torque, with a 95% confidence interval. There was a significant main effect for time observed with eccentric knee extension torque, with declines between visit 1 and 3 and visit 2 and 3. Although the cause of decline is not confirmed, it is predicted that the participants were exhausted while performing the eccentric knee extension. The limb symmetry indices were high for all measures. Rectus femoris flexibility, 103% symmetrical. Single leg counter movement jump height, 102% symmetrical. Concentric knee extension torque, 100% symmetrical. And eccentric knee extension torque, 99% symmetrical. There were no significant differences in LSI measures between visits. There were no differences in outcomes between males and females. In conclusion, there were no differences in outcomes between limbs among healthy, physically active college students in this study. The mean difference between the dominant limb and the non-dominant limb was 3% or less for each measure. These findings are consistent with previous research that reported minimal limb asymmetry in healthy college-age students. Previous research on collegiate athletes have reported significant asymmetries between the dominant limb and the non-dominant limb. Therefore, notable limb asymmetry may be more common in athletes versus non-athletes. As athletes specialize in a sport position, they may exacerbate the dominance of a particular limb from skill, repetition, and refinement. The physical demands on individuals who regularly participate in limb-dominant sports may contribute to the development of considerable limb asymmetries over time and propose concerns regarding sport-related injury and performance.